Good afternoon. This is in continuation of earlier class, sources of drugs, and this is regarding how the drug is to be administered in the body, that is route of drug administration. Broadly, it can be a enteral route, parenteral route, and a topical route. Enteral means oral route or other than the parenteral routes in a GIT, and a topical route. This is a placement of drug directly into any part of the GIT is called enteral mode of drug administration, which can be orally, which generally people take a tablet or capsule or syrup with the help of water or plain, and a sublingual tablet which is to be placed under the tongue and which will produce a systemic action, and another is a rectal administration. As I told you in last class, there are suppositories and preparation. The medicament is to be made up in a theobroma base and which will melt at body temperature. So can be useful for hemorrhoid cases or for laxative property, and likewise the other preparation like passages which are to be administered in a vaginal route, it is not called as internal route because it is away from the GIT system. The route other than the enteral route are called the parenteral route, which can be intravenous, intramuscular, subcutaneous, intraperitoneal, intraarterial, intrathecal, intramedullary, intracardiac, intraarticular, and inhalation route. Out of this, the intrathecal route can be useful for administration as well as for the diagnostic purposes, for taking out the CSF fluid for the consequences of meningitis and other infections and all that. The topical route include transdermal. These are the patches which are to be either stick on the skin or to be inside the skin, and conjunctival, that is to be instilled in a eye, vaginal or urethral, as I told you, the passaries and bogies, and rubbing part, the injunctions, like in case of liniment. The most the most common use route of administration is oral, because of certain advantages, like it is a most safest one, most convenient. The self-medication is possible. Anybody can take oral medicine except in case of pediatric or neonatal, this one. And it is economical also because no specific instrument or equipment is required, and there is no need of sterilization of tablet and capsule before to be administered by oral route. But there are a number of limitations while using this. The onset of action is slow, so it is not suitable for emergencies. Some drugs are not absorbed from GIT, like D-tuberculin, although it is not much use drug, but there are certain other drugs which are not absorbed from GIT because of a GIT enzyme and pH consideration. The unpalatable and irritant drug cannot be given. The most bitter in taste or irritant drug should not be given by oral route. Cannot be used in an unconscious patient and cannot be used in presence of vomiting and diarrhea. So you have to rely on parenteral route of administration. Absorption of some drug is negligible, like streptomycin, which is useful in the treatment of tuberculosis. The acid labile and substance which can destroy by gastric juices, it cannot be given, like penicillin G and insulin. they have to be given by parenteral route. And substance having very high first pass metabolism cannot be given by this route, like testosterone, the anabolic steroids, male hormone. There are one more particular type of preparation, as I told you last class, the entry-coated tablet. The drug destroyed by the gastric juices are to be coated with a keratin, shellac or cellulose acid phosphate, and these formulations dissolve only in a alkaline pH of the intestine. Means once you take all these medicine, it will not dissolve in a GIT unless until it will reach in a alkaline pH, that is in an intestine. So it will not destroy by the gastric juices. By preventing gastric irritation and alteration of drug in stomach, and to get desired concentration of drug in intestine, and it can also be useful for delay the absorption of drug. There is a time release capsule. Means you can coat the drug with certain components, like one will dissolve instantly and one will dissolve after 2 hours and another will dissolve after some hours. So there is a continuous concentration of particular drug will maintain in a systemic circulation. That is called as time release preparation or sustained release preparation or extended release, ER or SR preparation. That is what this is a particle of the drug dissolved at different time interval. The advantage of time release or sustained release, the reduction in dosing frequency, means you don't have to administer after every 2 hours or 3 hours. The maintenance of therapeutic effect for a longer duration of time, means once in a day dose is sufficient for this, and especially in a patient like asthma and all that, where you need a continuous therapeutic level of that particular drug, and it is appropriate for drug with a short half-life. Sublingual tablet, which are to be placed under the tongue, it is a highly lipid soluble and non-irritating drug like nitroglycerin or isopropanol, which are to be placed under the tongue. They rapidly dissolve and are quickly absorbed in a systemic circulation, and they bypassing the portal circulation. All those side effects because of portal circulation, hepatic one, can be avoided. Advantage is rapid onset of action, very fast. First pass metabolism is avoided, so drug can be spitted out if side effects are absorbed. Generally, whenever the nitroglycerin tablet is given, so side effect in the form of headache is appear, so you can ask the patient to spit it out. Disadvantage is unpalatable and irritant drug cannot be given by this route. Rectal administration, it can be given in a patient having nausea and vomiting. First pass metabolism is largely bypass. Irritant drug can also be given by this route, and the example is a Dulcolax, aminophylline and indomethacin. Dulcolax for the constipation, aminophylline is for the asthma, and indomethacin is a non-steroidal anti-inflammatory drugs. But the disadvantage is that the chances of rectal inflammation is there. The absorption is not reliable, so you cannot just reliable on the amount of the drug is actually required while giving rectal administration. So there may be a chance of extremely high dose or extremely low dose, and of course it is inconvenient and embarrassing to the patients also. But it is used in a pediatric population, especially paracetamol suppository and for the laxative property. Parenteral routes, these are the administration of drug by an hypodermic needle directly into the vicinity of the tissue, fluid or blood without having to cross the intestinal mucosa. The advantage is the rapid onset of action. Immediately it produces action. Depending upon whether you are giving intramuscular, it will take some time. But when you are giving intravenous, it is a spontaneous type of action is there. As first pass metabolism is bypassed, so lesser doses drug is required, and it can be employed in unconscious, uncooperative patients, and it can also be employed in a presence of nausea and vomiting. Actually, it is only drug of choice, route of administration choice in case of unconscious or nausea and vomiting type of patient. Non-absorbable and irritant drug can also be given by this route. Large volume means you can give liters and liters by this route, and the amount of drug can be monitored by therapeutic drug monitoring by taking a sample and all that. So you can control the drug administration. Disadvantage: it is a less safe comparison to a oral one, more expensive as sterilization is required and you need a needle and all that. Inconvenient, painful to the patient. So self-medication is difficult, although the diabetic patient do this, but it is a difficult one. Chances of local injury, that is phlebitis at the site of injection. And the most critical disadvantage is this: once a drug is administration, it cannot be withdrawn. Means if by chance or by mistake the drug is administered wrongly, it cannot be withdrawn. That is the greatest disadvantage of parenteral route. I'll come one by one. Intravenous, it is injected directly into the circulation, mostly antecubital vein. Large volume can be administered. I told you liters and liters, and for continuously for months together can be administered. Blood transfusion can only be done by intravenous route only, and suitable for dehydration. All your rehydration solution can be given by this route. Disadvantage is required aseptic unit, IV set, no retraction of the drugs once given. Drug which can precipitate or cause hemolysis should not be given, and oily solution or a suspension thick one should not be given by this route. Next, most common is intramuscular. It can be given in the deltoid or gluteal muscle, and less rich supplied with the nerve, that area. Solution as well as emulsion or suspension can be given by this. There is no restriction on that. Most preferred route after oral, and depot preparation which have a sustained type of action for months together, like for contraception and all that, can be employed by this route. Disadvantage is this: only small volume. Like in case of intravenous you can give liters, but in this case maximum up to 10 ml can be given, and chances of abscess formation are very high. Subcutaneous, it is to be injected into the subcutaneous tissue of the skin. Self-medication is possible as deep penetration is not required as in case of insulin. Less vascular and more richly supplied with the nerve, pain on injection, and only non-irritant substance can be injected by this route. The other related subcutaneous route is a dermojet, that is drug projected with a high velocity jet through a microfine orifice, and a palate implantation, like it provides sustained release of drugs over weeks and months, like testosterone. This one, a small cut will be made and the palate to be inserted and implanted, and the drug is released slowly for months. Intraperitoneal route, although it is not much used nowadays, earlier it was used for anti-rabies vaccine, that is a famous 14 injection for one bite. So it was injected into the peritoneal space, common laboratory procedure but seldom employed in adult. Used in infant to administer fluid like glucose saline as a peritoneal offer a large surface area, but not much used nowadays. And the disadvantage of this was the painful, and chance of peritonitis was very much high. Now the intramuscular formulation of anti-rabies vaccine is available and that are used. Intra-arterial, it is to be injected into the lumen of desired artery, useful in a diagnostic study to withdraw arterial blood for BGA, famous, the blood gas analysis. The radio opaque contrast media for the coronary and cerebral angiography it is used. And many anti-cancer drugs like nitrogen mustards are perfused through the artery to treat the malignancy of the limbs. Intrathecal, it is to be injected into the subarachnoid space. It is mainly useful for the radio-opaque substance for visualizing spinal cord, and a xylocaine injection for providing spinal anesthesia, and diagnostically for the diagnosis of meningitis. But it is very much used in all major operation, gynae surgery, in which the combination of anesthetic agent to be given into the subarachnoid space for the spinal anesthesia, lower limb anesthesia. Intramedullary, it is the drug is introduced into the bone marrow of the sternum or tibia, but not very much used. The blood is occasionally given by this route. Next one is intracardiac. In a sudden cardiac arrest and other cardiac emergency, the adrenaline is directly injected into the heart by a long needle into the left fourth intercostal space close to the sternum. In an acute cardiac emergency, it is used. Intraarticular, certain drugs like glucocorticoids and hyaluronidase, these are used and administered directly into the joint space in a rheumatoid arthritis. The hyaluronidase is very much used. It is to be directly injected into a joint space between the knees for osteoarthritis also. Topical route, there are transdermal patches. The adhesive matrix patch containing drug applied to the skin, chest and upper abdomen are used. They are slow but sustained release of drug. And clinically, nitroglycerin, scopolamine, ketoprofen and indomethacin, they are very much used in a patient which are used chronically for certain ailments, these drugs. But the local irritation is a disadvantage for the continuous sticking of that patches on the surface, body surface. The other routes are the conjunctival, which is to be instilled into the eye in the form of ointment, in the form of solution, that is isotonic aqueous solution, and it may be in the form of eye drops. The example for this is sulfacetamide eye drop, betamethasone cream and drops solution, gentamicin drop and ointment, and ciprofloxacin both drops and ointment. It is used clinically. There are other topical routes like I told you in the last class, the type of formulation, the vaginal and urethral. Vaginal, they call it as a passeries, and urethral is a bogies. The solution, ointment, emulsion, foam tablet, passeries can be given by this route for their either contraceptive purposes in the case of vagina, and for other either for antibacterial or antifungal property. There are certain antifungal, antibacterial and amicidal drops are used for the local application also. Next is injection rubbing. The rubbing the drug penetration into the skin. The antibiotic, antifungal ointment, powder, solution, paste, lotion, creams, they are used locally on the body surface. I think there are other route of administration or formulation are there. One is called it as a prodrug. A prodrug is converted inside the body into an active drug. Means when you administered drug, it will convert in a certain other form into the body, which produce their pharmacodynamic effect. Like the product may not undergo first pass metabolism or produce GI toxicity. The example is cyclophosphamide. Or in case of Parkinsonism, the drug administered is a levodopa, which then convert into a dopamine and which produce their pharmacodynamic effect. Nowadays, there are liposomal drug delivery systems are available, like liposomal amphotericin B for the treatment of leishmaniasis. They are targeted oriented drug delivery systems, and they are the minute particle of minute phospholipid in aqueous solution, and these vesicles may be filled with non-lipid soluble drug. So lesser drug is required and it is a target one, but pharmacoeconomic point of view, they are very costly medicine. The other technology is known as a nano-encapsulation or nanotechnology, in which the smaller amount of drug to be administered in a nano form at the target site. The other one is a nasal drug delivery system, in which because nasal is a highly vascular area, so drug is to be administered by a nasal route for certain ailment. However, this is not very common, but there are certain drug molecules which are under development and can be useful for the nasal drug delivery system, just to bypass the first pass metabolism, so as to avoid or reduce the side effect. These are all about route of drug administration. And the tomorrow class, not tomorrow, the Friday class, that is on 21st, 8 to 9, that is a newer drug delivery system, will not be held on 21st, and we will cover this topic in detail while we are going to take the drug delivery system on 8th of September 2020. So Friday, this 21st will not be held, and it will be taken up on the 8th of September when we take the newer drug delivery system in detail at 2 to 4 p.m. 2-hour class. Thank you very much. Stay safe and see you. Thank you.